Welcome to RFS Tackle Mental Health Podcast. This podcast is all about highlighting our youth and their mental wellness. RFS Behavioral Health is Northwest Ohio's leading school-based mental health provider. And in this episode, we're talking about codependency with Rodriguez and case manager Elicia Garces. If you want to keep up with us, make sure to visit our website at rfsTackle.com. And if you want to follow us on social media platforms, just search RFS Tackle. Let's get into it.
My name is Nina Rodriguez. I interned for the agency for the last 2 years, so throughout the pandemic. And then I started working here this year. So I'm the therapist at 2 elementary schools in TPS.
My name is Elicia Garces. I've been with the agency since I was an intern. I started my internship in 2016. So I've been here a while, like 6 years, going on 7. I'm a case manager. I was at a elementary school, and this is my first year at a high school. It was the best change, and I don't like change. I was super scared, but I literally enjoy it. I don't know. It's just the dynamic is so different. I am mentally a lot better.
I believe codependency occurs within a relationship. This can be a relationship with your significant other, within the family, a friend. And I think that in relationships, we both bring things to the table. And when one side of a relationship there's lack. Naturally, the other person is going to fill that void of where there is lack. And I think that creates normalcy around, it's not just like dependency where you're just kind of like supporting at that time. It's actually something that you're, stepping up to the plate all the time. So there's lack. I'm naturally going to step in and fill in that void. And then I think there creates like normalcy around that. So once there's normalcy built, our brain function just I think that's why they call codependency a psychological construct, because it naturally, you train your brain to normally continue to fill that void wherever there's lack.
You definitely develop certain behaviors. Personally, I feel like codependency is so broad because you can become codependent not only in people, but in things, such as like food. I think drugs, alcohol, all of that. So I feel like codependency, though, a lot of it is based around childhood trauma. And that's when the codependency really occurs, when you start to get older and you learn those codependency behaviors. And then when you get into the relationship, like Nina said, where there's things that lack, you get into this like behavior mindset of, okay, I have to do X, Y, and Z because I need this person, or I need to do X, Y, and Z because I need this to fill this void or fill this way, and certain aspects of whatever the codependency is. From my personal experience, my codependency came from, I feel like it came from like a positive and a negative. So I will say I became very codependent on my dad. And maybe that's a nurture thing. I'm not really sure, but my dad was very invested with being a really good parent, in the sense of like whatever I needed, he would fill. But because of the relationship between like the family dynamic in the household and the things that I was seeing, I started to become emotionally and codependent on food. And being a minority woman, but a minority girl at the time, food was comfort, and it was pushed in every area. So I learned that codependency, for me to feel happy, food, or for me to feel happy, I go to my dad because he makes me, he does certain things that make me feel a certain way. So I will say the codependency came from a healthy but then unhealthy balance of certain traumas that I was going through in my youth years that I wasn't even aware of until I became an adult.
I would say mine is strictly unhealthy. So good for you that you have some healthy factors happening there. I feel like mine was definitely these traumatic life experiences coming from parents that were just lacking basic needs. And I think that comes in with poverty, living in a household that has substance abuse. So that
violence.
Yes. Naturally, you see these traumatic experiences happening, especially for a child. You want to prevent as much as possible from that happening again. So to prevent that, I'm going to do everything in my power to make sure that the basic needs are met and that this does not happen again, because my body doing what it's supposed to do is going to try to prevent this bad thing from happening again. So naturally, I'm going to step up to the plate and fill that void.
This one is like, I feel like this one just like hits me so hard because I didn't know how codependent I was when that came with being an emotional eater, and then being so codependent on my dad. Until I had to have that conversation. Like we do like these check-ins where we'll go do coffee or get food and things like that. And I would say my codependency with him was pretty much, he just had to sit me down like, Miha, like you are creating things in your relationships because you are so dependent on me. And it kind of goes, and he's taken responsibility in the sense of like him making sure that he raised me to be an independent person and not have to depend on a man aspect. But it was kind of like, well, like in my relationships, I was so codependent on my dad when my boyfriend wouldn't do something, I instantly would be like, in my head, I'm like, okay, I'm going to call my dad. And I would call him like, Dad, can you come fix this? And not even have that conversation with my significant other of like, well, hey, just do this. So I became so codependent. Like I was creating issues in my relationships because of the codependency of being able to always fall on him. Like he had to bring that to my own reality because I thought that was normal, right? Like I don't need anybody besides my dad. And it creates other traumas. Like when you're in a relationship and it's like, oh my God, why am I creating this? Well, because you're so freaking codependent on your father. So,
I think that a sign would be not being able to make your own decisions. Like you're saying, like you overthink things. You're thinking for another person. You're not actually looking at the situation for what it is itself. You're truly just thinking, well, let me check in with that person first to see what they want and need. And I'm not thinking about myself whatsoever. And then you overanalyze very simple things such as, what do you want to eat? It's not that simple. I don't know how to make that decision because I've never had just myself to make that decision and just to think about myself. So I think when you start seeing behaviors like that, also terminology that people use, like I think like when they label themselves, like I am the caretaker, I am this, I can't do this without this person's permission. In a sense, nobody's actually going to say those words, but you can see it in their behaviors and the terminology that they use. You can that for me, like as a therapist, when I assess people and like the verbiage that they use, that's something that I can see is when they say things like that, they're unable to make decisions for themselves and they really have to think about everybody else but themselves. But I think that's where trauma comes in because you can see there's like post-traumatic behaviors that you're seeing. You're not in the situation anymore, but you're acting as if you are, but you're not. So it's, for me as a therapist, I can really assess when people have had that codependent relationship growing up and a sense that it is traumatic because you personalize all of these things in your life. You don't look at it for what it is. You don't look at it for just yourself. You are involving everybody else except for yourself because that's all that your brain has been trained to do. I will say like working with the youth, the teenage aspect, it has, even though I've only been doing this not even a full year, in the high schools, it has brought a lot more to light for even my interpersonal self because I work with 11th and 12th graders that are getting into these relationships that have never seen a healthy relationship, that are already struggling. And then I've had these conversations in the past like 2 months with multiple kids of being codependent. Like, okay, why are we sitting here and you're so hyper focused on, am I going to see him? What is he going to think? Or the, vice versa. So it's definitely the verbiage, the way that their body responds, their body language. But it goes back to
childhood trauma and what they've seen, what they've been taught, what they've lacked, have not, received from parents, or just any forms of like healthy boundaries and relationships, and just even healthy communication.
Yes.
So
yeah, absolutely.
I had to really think about this. Is it a red flag and you run, or is it a red flag and we talk about it? Because I think everybody has some form of codependency. But I think when you get with a person, you have to have these conversations, right? What are you codependent on? Because everybody can sit here and be like, oh, I'm not codependent on nothing. Yes, you are. It could be shopping. It could be, parents. It could be another person. We're codependent on something. I think if people are aware and you figure out how to learn how to work with the codependency, I think that's a good balance. But if somebody is very like, no, I'm not codependent, for me, I would say that's a red flag, because they're not in tune with who they are as a person. And I feel like that's when codependency is at like an ultimate high for a person. If you are not self-aware that you are codependent on something, they're not just self-aware on who they are. And that's a red flag right then and there.
You start to lose yourself. That's why I say it is a red flag, because you lose yourself naturally as who you are as a person. You're naturally revolving your life around another person and not looking at things for yourself, which further leads to trauma and damage to your life, and even becomes like harmful for a person. So I think that it is something that once something becomes from dependency to codependency, it is a red flag, and we should be talking about it instead of ignoring it. But I think we do go in denial, like naturally, especially as children. I don't know any better. So I think that awareness is key with that, but also communication as well. Like we need to be talking about it and having these conversations. But if somebody we can't control if the other person's going to be receptive to that conversation or not. So I think acceptance comes with that as well.
Yeah, I think if the person is not like just grasping and understanding like, hey, you are codependent on something, that is really when like you need to be thinking, because it's easy to get attached to somebody that does have a negative codependency 100%.
And we do what's comfortable as humans.
Oh, we do. Change regardless. Like I know for me personally, good change and bad change. And change in general, like it's scary. So having a negative codependency, like it can be really bad, especially if you're just like, no, I'm not codependent on anything. Like, oh, no, dog, you are. You ain't got a lot of me, because I got some codependency in me too.
Right. Yes, especially post-pandemic, with all of this trauma and all of this like poverty and grief, all of that. Parents are, at least with the kids that I work with, they're lacking basic needs. They do not have enough resources. So naturally, these kids are just stepping up to the plate. And typically, as we've learned, like in school, is the oldest sibling in the household will be the one to step up. And so with the younger ones, I can see they're trying to make ends meet basically, but they're children. So it's just very difficult for them. And that's when you start to see these like problematic behaviors in the school, because they're upset and they're frustrated and they're irritable, but they don't know why, and they don't understand why life is like this. So I think that's definitely increased after the pandemic, but I can see with my like teenagers, the older siblings, every time I ask if it's if they feel that they caretake it all, and that I basically ask if they're in a codependent relationship without asking them directly. Every single time it has been yes. And I ask, what order are you as siblings? And they're always the oldest. So I do see that that's like a common thing, that they are the ones that step up and fill in whatever void is happening in their household. So yeah.
Codependency is very like broad, because it's not just relationships. A lot of my kids are becoming very codependent on drugs, phones, social media. Like it's like if they don't have what social media is looking for, then life is over. Like and for me, I work with majority of teenage girls. So I'm really big on pushing them to just be self-aware and that self-confidence, because they they become so codependent on like approval. Like they need constant approval from people. Well, do I look good? Well, does this, is this the trend? Does he love me? How is he feeling? And just X, Y, and Z. And it's just like, you don't even realize that you are becoming codependent or that you are codependent. So these are those conversations. And the same, I will say, also with, okay, so a handful of my young girls are actually being raised by fathers. And it's wild, very, very wild when I tell you, like, this was a conversation that I just had with my dad. Like, they are learning codependency when it comes to that male figure too, but they're also, I believe in trauma bonding. And some of my girls are trauma bonding with other people because they're becoming so codependent on trying to find a certain form of love that they did not receive from the youth. So big time. There's just so much happening because of COVID. And I will say that codependency has took a rise really fast. And it's just like the youth they really don't understand it. And it's just, they don't even know what codependency looks like until you have that conversation with them. I would say that a lot of it is coming from my girls that are the oldest sibling, or even the middle child. The middle child 100% becomes codependent on something. So it's
that makes sense to me.
Yeah, it's very, very mind-blowing.
I think going back to what we said, just starting with being communicative, but also accepting the fact that that partner might not be receptive to that conversation. Also, when you're in it, you don't see it as much as you do when you're out of that relationship. And that's with any type of relationship. When you're in it and you are in a codependent relationship, it is so natural and normal to you that you do not really notice. So to even call it out and talk about it will probably be at a time where it's already normalized, rather than like, we're starting to see the signs. Let's really talk about this now. I don't want to say too late, but we've kind of normalized it before we're actually going to start talking about it. We're going to see problems before we start talking about it, rather than the red flags.
Because as people, we get into this mindset of like, okay, let's not say anything so we can see if they change their behavior without me saying anything. And then it gets so far gone. It's like, how do you approach this? Like, hey, you're becoming very codependent on X, Y, and Z without them feeling some type of way. And you kind of allowed it. We have allowed it.
Yes.
So it's kind of like, it's
uncomfortable.
It's very uncomfortable. And as humans, we don't like to have uncomfortable
discomfort,
right? We don't like discomfort. We don't, because then with discomfort comes with possible disagreements. And I think we get into this mindset of like, if we disagree, then we're arguing. No, like you can have a disagreement and just be like, okay, well, I don't agree with you, but I respect what you're saying. Then you learn that whole cycle of different things that stir up with the codependency.
Back to, I think red flags are important to notice and call out, because that's when you start seeing them. We should start talking about them right away.
Like, I don't like X, Y, and Z. So
what can we do about it though? Like, but you can't also, you have to have acceptance to be able to accept the fact that that person might not be receptive to you bringing it up or being communicative and see it in the way that you're going to see it. Maybe they don't see it at all.
I think this has been such a big topic for me with my older kids. And I think it just really goes back to like people in general, overall, stop preaching to the youth about trying to get into relationships and having their lives together, and really just focus on like being in tune with self. Because when we're in tune with self, you don't get into these type of situations. Or if you do, you talk about it in the beginning, like, nope, this is what I'm not going to accept. So it's really like, I will say, like, if we would really start focusing on the boys, girls, everything as a whole, who are you? What are you going to accept? What are you going to accept from yourself, and what are you going to accept in another person? But do you match that? So until you can match what you expect from other people, just focus on yourself. Love yourself, because then the codependency lacks of like trying to become attached to something. And that's one reason why I go back to having a good sense of self, because I was the same way. Like my dad, he did not. Like I played with Brett dolls until I was 13. Like he did not. He always wanted me to be a kid. So when I got in high school, all my friends were getting cheated on, and I was like, oh, I'm not about to be crying. I'm not about to be codependent on no man because, you know, my daddy said X, Y, and Z, you know. But it allowed me to just be a kid and not become so focused on like needing a boy, you know. And that was my own personal thing, but I have seen like how it has helped me, you know, just being an adult. So
I always start with just kind of what I'm doing for that person. I'm just providing you a safe, confidential space to be able to talk about it. Because if somebody can just simply talk about it, that will increase their awareness in general. So increasing their awareness without me even having to make any suggestions or recommendations, just letting them talk about it, bring it to surface, and then let them identify, like I guess giving them prompts, like what, you know, can you identify what you think a healthy relationship looks like? What are some things in your upbringing that your parents taught you, or maybe other relationships that you've observed? What does that look like? What does healthy ones look like? What do unhealthy ones look like? And I think that pulls out their beliefs, which is very huge. Like knowing what somebody believes in, like, oh, well, I believe that, you know, I was raised to, we do this in this, like in our culture. And I think that, okay, how does that apply to your friend? What role do you play in your friendship? What do you have control over in your friendship? What is going to be comfortable to bring up with your friend about this? In a way that, you know, let's explore ways that your friend would be receptive to listening to this. Are they more receptive to a text message, maybe a call, maybe a conversation in person? And then really just like gaining their awareness without us having to make any suggestions, because as therapists, we really should not be doing that. So I think it's just kind of like letting them realize what control they have in their friendship and not, what role they play, where they're comfortable with intervening, but also for them to provide that safe space for their friend, just to increase their awareness too. Like, let's just talk about it. It's a safe space to talk. I'm here to listen. And really just, I guess I don't want them to get overly involved in their friends' situation. Just simply be there to help them increase their own awareness about what's going on and maybe even educate them further. Like for myself, I would definitely bring my education to the table if I felt that I could do that with a friend, and really just like help bring their awareness up, but also like educate them in the sense of like, these are some signs of codependency. I might be seeing this in you. And I just want to see like what you think about it. I'm not telling you what to do. I'm not telling you, you know, I'm not making you do anything, but just really opening up that conversation with their friend or their peer or whatever, to make them feel comfortable enough to talk about it, to then further allow them to admit like, okay, yeah, I am in a codependent relationship. I didn't even realize I was, you know, just opening up that whole platform.
So for me, this is hard, especially when it comes to abuse and just like being in that, I hate the word toxicity. I do, because it's just like just used inappropriately. Yes. But it's more of like allowing my client to be like, okay, look, this is what's going on in my friend's relationship, but also letting her know that she has to set a boundary, a healthy boundary, so she doesn't become someone invested, because as people, we do what we want. At the end of the day, somebody can talk to you, somebody can give you all the resources. But it goes back to having a good sense of self and loving who you are as an individual. So that is my number one push when it comes to men and women. Have those conversations of like, what do you love about yourself? Understanding their supports around them. Or when this does happen, where can you go to feel safe, or in X, Y, and Z? I feel like this is such a uncomfortable, that conversation, because it's more of like, you want to be like, okay, this is what you need to tell this person, this is what you need to do, and that's unhealthy. But allowing the friend to see like, these are boundaries that you need to know, but also teach your friend too, and having, here's a list of where your friend can go, and you can also be a support and go with them if they, you know, if they need to go seek help, or if they need to go talk to somebody. But it's really pushing for my client to be like, okay, we're going to focus on self-care and self-love, because when my client feels self-care and self-love, they're also going to preach it to the other people around them, and being able to express like, okay, you're in this really bad situation, but you can get out of it. And this is how you can get out of it, with me being a support, but not overstepping. Because if you overstep, it's going to completely shut that friend down. And then we're not going to be able to help at all.
I love that.
Yeah.
I think modeling is huge for human behavior. Learned behavior is majority of what we do. Mm-hmm. We do what we see. And when we know better, we do better. Yep. So I think like, that's why I go back to like increasing their awareness, just so they know what's going on, just being more aware. But also like modeling that for them, you know, like you said, setting a boundary with my friend, seeing that it's healthy conflict, healthy conversation, healthy boundaries been set, it's been respected. Oh, okay, maybe I could do this in my relationship too, right? Like teaching your friends how to do that as well.
So I think it's just, that is so important, because our youth does deal with that. I've had multiple girls that are like, Miss E, my friend is like, the boyfriend is cheating or the girlfriend is cheating. Like, how do they navigate this? Well, we can't change what they're doing. We can't change people, but we can educate them, right? And if my client is very educated in the sense of like how self-love and we doing things that best fit us as a human, she can, you know, push that along. Yeah. But I can also give her the tools in the sense of, you could go here, you could go here. Here's the support. This is some things that you can do, you know, if she does decide to cut that friendship off. It's accepting first. You have to accept, because if you're not willing to accept that you're codependent, you're not going to be able to make that change. And you have to start with baby steps and realistic things. I think we get into these mindsets of, for example, I will use this. I became so codependent because I was an emotional eater. So food was my codependency. And I used to be in this mindset of, I'm going to go on a diet. I'm going to try Herbalife. I'm going to do this. I'm going to go to the gym 5 times a week. It was not realistic. But if I'm able to navigate it in a sense of, okay, I need to become healthy, so that I'm not so codependent on foods and overeating. So being educated, what are some tools that can help me not be so codependent on food? So it's like, you have to be realistic, but you have to accept first that I'm codependent on something.
Yeah, absolutely. I definitely agree with that. And I think that in a codependent relationship, you have to be able to set boundaries, but first the boundaries have to come from within you. You almost have to set boundaries with yourself, because then that further allows you to actually take action on it. Like you're saying, I could say all these things, but if I'm not setting the boundary within myself and these small, realistic, reachable goals for myself, then how can I actually break that tie in that relationship? Yeah. I think, like we've said, it's codependent relationships are unhealthy in a sense. And I think that sometimes they're to the point that they're unsafe. So I think that recognizing and assessing the relationship, you'll be able to back off slowly when you know it's safe to. You believe that it's safe to. Because oftentimes in codependent relationships, it's abusive and manipulative. And like, there's there's like a huge gray area around it. So it's not black and white. It's not easy for people to just say, okay, this is toxic, I'm going to step out of this. It's hard. And I think so that's why it's just like, okay, being aware and then accepting like, this is unhealthy and it's been unhealthy. This is all I know. I think utilizing resources though, like going to therapy is definitely beneficial, just to have that safe space to talk about it, realize and accept what's going on, and then say, okay, what can I do moving forward? How can I make sure, put myself in a position where I am safe now, so I can kind of back away from this in a way that is going to keep everybody safe, but also, you know, I have to learn how to even set boundaries within myself, because I've never looked at that any differently. You know, we've lived our life for that person and in that person's mindset, trying to think for them. Which is a lot of cognitive restructuring, and that has to come from therapy. I mean, it really does. It's human behavior in its finest.
I will tell you, boundaries are the biggest factor in codependency, and how to become, you know, not have that attachment. But we're not taught boundaries, because sometimes, I can't say because sometimes, a lot of time, especially the demographic that we work in, the youth can't even set any boundaries because they're in survival mode.
Exactly.
All the time. And it sucks 100%. So then they go through these traumatic events and then they're like, oh my goodness, I'm codependent on this. And then it's like, how do you set boundaries, right? I'm this person for so many years. When I do set my boundaries, then uncomfortable things start to happen. You might lose some friendships, right? You might have to detach yourself from a job and just certain things. So, and I didn't understand this until when I started working with the older kids, and I, started working with a different coworker, and her just being like, boundaries, like they're uncomfortable. But look, when you set boundaries and you understand things, you're not so attached to, certain things. And so that right there is like teaching our kids at a young age, setting boundaries when it comes to friendships, when it comes to parent, interactions, when it comes to food, when it comes to technology, social media, and things like that.
That's how it works. That's why I think the beliefs are so strong. Mm-hmm. I am this person. Yeah. I do this. Yeah. This is who I am. These are my values. These are my beliefs. Because I've been trained that way, though, you're not looking at it for how it should be or how it is right now. Like, this is literally what my brain has been taught to do. Yeah. This has been normalized. And now, of course, the other person in the relationship is normalizing it as well. So it's just normalized. And this is, but core beliefs are huge with the brain function. Yes. As we know, as behavioral health, professionals, it's everything. Your beliefs will influence your behaviors no matter what.
And it's like you have to untrain it.
You have to untrain
it.
And if you have longevity with that trauma and that brain function, it's going to take so long to get it to be another way. And we don't want to take the time and effort to do that because that's natural for human behavior. Like, we don't do what's uncomfortable. Yeah. It just is what it is. But I think that comes into like cognitive distortions too. Like, personalization is a huge one for me. I'm personalizing situations around me that have nothing to do with me. I have no involvement in this, but I believe that I do. I believe that I have to do something about it. And
because I'm a good person, right? I'm the good person. And sometimes we become so codependent on like, I have empathy and not everybody has empathy. So let me do X, Y, and Z to show people that empathy is real. And like, you can just be a good person. And that codependency sometimes on that. So like, codependency is just so broad. It's not just codependent on a person. Like, we become so codependent on different things, but then they start to mesh and then it blows up. But I think codependency just comes from a lot from childhood trauma.
Definitely.
And
I think it's important that we normalize it and talk about it because it's all humans. Like you said, like, it's not just people that grew up in a traumatic home and this big traumatic thing happened. We talk about in therapy, like little T trauma. There's little stressors that you went through every single day. You've literally trained your brain to be this way. I don't know any different. So why would I act any different? So that's just all brain function, truly. And just recognizing that it's an issue and like, how can I change that? But I think it's important to normalize it because it is all humans that experience it in a sense, and that are affected by it. And like cognitive distortions, like personalization, every single human has. And I think that as a world in social media, like, we make it seem like that is not true, but that is true. Every single human has cognitive distortions, but some people's are just more intense than others, such as personalization. Like, I feel like somebody in that relationship is personalizing all of it to make sure that everything's going to be okay, when that maybe doesn't even apply anymore at all.
I think working in the mental health field, we sometimes get so focused on always talking about the big T's, the big traumas, right? But it's really the little T's, the little traumas that start the little things.
The normalization.
And being a minority girl, right? We're taught when you're sad or when you're happy or something happens, you eat, because food brings people together, and the happiness when you're sad and X, Y, and Z. And that right there, for my own personal self, that started the codependency with the connections of emotions and feelings and behaviors when it came to food.
That it is in everyone's life, and that we naturally as humans are in denial. So talking about it is going to be uncomfortable, and that's okay. And we need to work through that discomfort, and we need to talk about things and be communicative and normalize that instead of normalizing being in denial and ignoring and avoidance, which is natural for our bodies to do, but it's something that we need to just be talking about more.
Yeah. Accepting mental health as a whole, because then that goes into, okay, let's do therapy, or let's get you a case manager that could work you into doing therapy and helping with some of the stressors that is causing the codependency, in the sense of like being able to connect to resources to just to do different things to help with my child's mental health, with my own mental health, so we don't learn these really, really intense codependency things that have a long-term effect.
Mm-hmm. Yeah, I think just learning those therapeutic techniques, whether that is going to therapy. I also had the thought of the 12-step program and how huge that is for people that grow up in homes that there's substance abuse, which is a lot, especially in our city.
Mm-hmm.
And I think that utilizing your resources around you, your supports around you, using those, learning those coping skills in those meetings, or going to therapy and learning those techniques on how to be aware and how to, have communication skills, even just to bring up these conversations. And then when, recognizing, identifying this discomfort, and then how can we work through that?
Just really, it really goes with accepting, just accepting, like, listen, you are codependent on something. And because I'm codependent on something, we've taught that behavior of this is normal. Mm-hmm. So just having uncomfortable conversations and hearing what your child has to say and allowing your child to hear you. That is, I feel like, is just so big and can help so much with breaking that cycle of codependency. Yeah, this was a conversation that I had with one of my girls, because she's starting to see the cycle of like being codependent on marijuana, but she was taught it from mom and dad. Mom and dad don't talk about their feelings and things that they're going through. We just kind of smoke because it relieves the stress. So having that conversation, because mom and dad, now they don't want her to smoke. So it's like, how, when you've taught me, like, this is how we work through the traumas that we've been through. So navigating that and understanding and allowing her to be like, you are right. Like, I am codependent on this, and I don't even know why I'm codependent on it, because when I'm done, realistically, I can't think of any healthy coping techniques, even though I know all of them and I know this could work, X, Y, and Z. So it's just kind of that acceptance. You have to accept and you have to hear each other out. Yeah. And it's hard for teenagers, right? We don't want to listen to mom and dad all the time, so we're going to navigate different things and become codependent on other things so we don't have to deal with this.
Which is why I say that safe space, whether that's a therapist or a 12-step program or like a support group, is nice, because it's not coming from your mom or your dad or your family member that you don't want to hear it from. It's actually just coming from somebody that, either is going through it themselves and like has that personal experience, or is just a safe space to talk about it.
It's always good to have another person. Yeah. But also, we're taught, not in every household, but I would say majority of the households, what stays in the home, what happens in the home stays in the home. And we have to break that cycle too. We have to 100%.